I'm Dr. Alex Bekker. I am a family medicine physician who specializes in homeopathy. Homeopathy is a form of medical practice or a form of therapy which uses natural substances to stimulate the body to heal itself. For example, the natural substance we use can be either it can be plants, it can be animal sources, it can be mineral sources. So those small amounts of medicine are used to stimulate healing. I've been a medical doctor since 1996 and have gone and I practice regular medicine as well as practicing homeopathy. So what we can say is that the main difference between homeopathy and regular medicine is two things. One is that in homeopathy we use natural substances as opposed to synthetic substances to treat the patient. And second of all, we use a different criteria for what we want to see improve in the patient. So our criteria is that we want to see improvement on a general level. We don't simply want to see just improvement in one symptom only. There are two things that we should know about homeopathy. So first of all, we should know that it's safe. It's absolutely safe. The question is, why is it safe? The safety of homeopathy is that we use very, very small amounts of natural substances. These substances are manufactured by specialized homeopathic pharmacies. These pharmacies are regulated by the FDA in the US, so they have to make these medications according to very strict specifications. The smallness of the dose makes it have no side effects. The second part is that homeopathy works by stimulating an organism to heal itself. So if we see that only one symptom improves, that's not sufficient for us to see that the person has improved. So we're looking for overall improvement in quality of life. There are many things that can be treated with homeopathy. So, for example, I treat children with autism. So what do we expect as improvement from children with autism? One is we want to see, first of all, what I expect to see is cognitive development, which means recognition in the child of what is happening and how they can do something about it. And second of all, we see more balanced emotional state. So if the child has some obsessive compulsive tendencies, or they may have tics, or they may have things like that, we want to see those things improve slowly over time. So those are the things that I see improve with homeopathy, for example, in children with autism. When we talk about the method that we call homeopathy, there are certain things that need to be understood. So homeopathy means that we are treating a set of symptom complex in the patient, or symptoms that are together in a group. We're treating those symptoms with a medicine that produces similar symptoms. That is technically what homeopathy means. For example, so a traditional medicine that has been used in the past is simply onion. So an onion, when you cut an onion, you get irritation of the mucous membrane, you get runny nose, runny eyes, you get burning, especially burning in the nose as you're cutting an onion. So there are many symptoms that come out when we're cutting an onion, or some people are sensitive to onions, they may get symptoms from that too. So all of those symptoms can be useful to a homeopath when we treat someone, for example, with allergies. So someone with allergies may have severe allergies that can be treated acutely with a remedy made from the onion itself. When we have a regular medicine, let's say if someone has a headache and they take a Tylenol, what is happening is that there's a suspension, or we can say suppression, of the symptom temporarily. So what we're treating is one symptom, most of the time only one symptom only. If someone is treating headaches with homeopathy, then we have to be much more cognizant of the whole complex that is happening, the symptom complex in the patient, whether the patient's headaches are left-sided, right-sided, whether they have nausea with the headaches, whether any other symptoms are there with the headache, and that tells us what we call a symptom complex. So we're treating, first of all, the symptom complex, and second of all, if we're going to treat preventatively for the patient, we are also treating the patient as a whole. So one thing that I think should be made clear is that homeopathy is not about one particular physician or even a group of physicians. But homeopathy has a long history behind it, and at this point, when I went to a recent international conference, there were already over 70 countries were represented. Homeopathy is about something that has been going on for a long time. At one point in the US, before 1920, there were many homeopathic medical schools. There were physicians who were graduating as homeopathic physicians. So this has a very long history behind it. And the fact is that patients have found this medicine especially effective for a long time. Over the last 20 years, what we have seen is maybe a small explosion of research in the field. Every year, well, every other year actually, we have been meeting in University of Connecticut and having our conference. We be a international research conference where we have researchers from around the world come and present papers. This research can be classified into basic science research. We have researchers who are doing on agrohomeopathy, which means using homeopathy in agriculture and plants. Veterinary homeopathy, we have researchers, of course, in clinical homeopathy. So the last 20 years especially, we've seen a huge number of studies that have come out, also studies on how homeopathy works. So actually, we don't know exactly, but we have gotten very close. We're getting very close to understanding exactly what is happening when we're treating with homeopathy. And on our website alone, when I say our, meaning our organization, American Institute of Homeopathy, we have curated more than 1,000 studies that have been done. Another website that we use is Homeopathic Research Institute, or HRI, which has even more recent and cutting-edge research on their webpage if someone is interested. There are two aspects to this. One aspect is that when we use the example of what homeopathy is, so what we can say is that when we're watching it work, then we can see that what is happening is that we can infer what is happening is that the organism is reacting to the substance that we give, and it's a mild reaction. However, that mild reaction is sufficient to overcome the illness in the organism. So essentially what is happening is, we can maybe call it like a strengthening or a strengthening of the vitality. Another way to put it is we see a kind of a balancing in the organism that is happening. So we see those things. That doesn't tell us exactly how it works, but it gives us a clue. That's number one. Number two is the actual research on the homeopathic medicines themselves. Are they able to actually produce biological reactions? So that kind of research has been ongoing, and yes, we see biological reactions in actual biological systems. So we have quite a bit of research on that level, and the actual fact that the very smallness of the doses does not preclude them from working. So we know it's happening. The exact mechanism is unknown because simply the issue is complex, because the living organisms are very complex, and therefore to know exactly what is happening will require quite a bit of more research, but we have some very good ideas at this point. I always think of one case of a baby. I saw a 3-week-old baby, and the mother came in with the baby complaining. The baby is just crying. And I said, how long has the baby been crying? Well, since birth. And when does the baby stop crying? The baby is crying almost nonstop until he falls asleep. This is constantly for 3 weeks almost. So I asked the mother what happened 3 weeks ago, and she said, yes, it was a very quick labor and delivery, and I came in to the hospital and they gave me a pain medication, IV pain medication, and the baby was born shortly thereafter. So in what I figured from that was that it could be that the baby was suffering from opiate withdrawal. Normally, these reactions are temporary reactions. Opiate withdrawal is temporary. But in a baby, this may not be something. So, temporary. So, I had immediately I went to, because there's only one remedy that we use for that, and I went to my drawer, gave the remedy to the baby, straight to the baby. It's little tiny sprinkles dissolved in the mouth. And then continued to talk to the mother. 5 minutes later, the baby stopped crying and fell asleep. So we thought, okay, maybe that was just coincidence and the baby was quiet, and the mother called me the next day. The baby was still not crying. And of course, it was crying like it would normally cry. But this constant whining and crying was stopped. And that was it. Just one dose of a medicine. So those of us who practice homeopathy on a regular basis see cases like this often, and for us to think that homeopathy could be placebo is very unlikely. The best way to look at it is we can divide disease into two categories. We have acute disease, we have chronic disease. So acute disease generally will, like a cold, it will come on and it will go away, usually on its own. If you take something for it, like a homeopathic medicine, you may expect alleviation of symptoms faster, you may expect to feel better faster. And sometimes one dose is quite sufficient. And sometimes not. Sometimes we repeat, especially if someone has a severe cold or flu, we treat things that are infectious diseases like that. So they may need multiple doses. So the dosing in homeopathy depends, it's a little bit dependent upon the prescriber. So some prescribers may prescribe a little more frequently. The general rule is you repeat a dose when the symptoms return, or when the symptoms are about to return. So in acute cases, one dose may be quite sufficient. In chronic problems, what we deal with is, the way I kind of tend to look at it, is like a glacier or iceberg, right? We look at the tip of the iceberg, we see the symptom. Well, it may be allergies. If it's allergies, then what is happening with the patient? Well, it may be a whole immune dysregulation problem. So it's not such a small problem as we think, allergies. So we may be able to help the symptoms, but if we want to change the way the immune system is working or balance out the immune system, then we will need time to work on it. So we give a dose, we see how it's working. We may need to repeat something in a week or 2 weeks, depending upon how we're treating the patient. We may need to change the medication that we give the patient to help the healing go on forward. So generally, the way I explain to patients, there are 2 things that can happen with a homeopathic medicine, which sound very simple. Either it helps or it does nothing. If it does nothing, it means simply that a different medicine is indicated. If it's helping, then the question is, how much is it helping? If it's helping a little bit, okay, good. That means we may need to repeat the same medicine. Let's say it's only helping a little bit. It may be that you need a slightly different medicine or something that is related to that medicine to help things along more. After the discovery or rediscovery of homeopathy, what quickly became homeopathy became a very, very strong scientific discipline, not only for the doctor who was using it, but also for the pharmacist who was manufacturing homeopathic medicines. So for example, in the US, you have the Homeopathic Pharmacopoeia of the US, which is the standard that is used to manufacture homeopathic medicine. FDA uses those standards to evaluate pharmacies that manufacture homeopathic medicines in the US. So these are very specific standards. As far as practice is, you have certain standards for practice as far as anybody who practices homeopathy seriously. So these standards are regulated in the sense of that the good schools of homeopathy teach those standards, and those standards are accepted widely. So what we can say about homeopathy, I think it is essentially a scientific discipline. It is not a discipline that requires anybody to believe in homeopathy. Yes, we can believe in homeopathy, but the reason we believe in homeopathy is because it works. One thing that we haven't mentioned is something we call individualizing the prescription of homeopathic medicine. So whenever we are treating a patient, we are looking at all the symptoms, all the symptom complex, and the patient himself in order to treat them. So the prescription has to fit the patient, has to be specific for that patient. So if a child has an earache, one child's reactions to pain, to the fever they're having, to how they're sweating or not sweating, their physical and mental reactions to that same earache are different. Therefore, each child will get a different medicine from the homeopathic practitioner. So the research that has been done in the last 20 years has been very interesting and exciting, and the question goes back to how homeopathy works. So homeopathy works through the reaction to the medicine, but the medicine that we give is so small. So the smallness of the dose implies that the way it's acting is more than we know. It's acting in such a way. So it goes back to perhaps studies in what we call the latest quantum physics theories, or the latest scientific theories, which give us an insight into what is actually happening inside each person, or each living being, or even each non-living being. So what we were talking about is we're on the cusp of understanding more about what is happening. So there are two organizations that we can say are the main consumer organization. There's an organization that has been around for a long time, and that is the organization called the National Center of Homeopathy. There's a more recent group that is also a consumer-based group. It's called Americans for Homeopathy Choice. In order to have a real choice in healthcare, we need to have the knowledge of what our choices are. So first of all, we need to understand what is out there, such as homeopathy or other options for what we call natural living options. Once we understand those choices can be made, then we have a choice. Without that knowledge, there really is no choice we're making. So the first thing that we need to know is we need to have the knowledge. So we need to understand what this is and how it can help and when to use it, and also, of course, when not to use it, when we need to rely on someone who is an expert in some field, whether it's an expert in the field of medicine or any other field. And of course, the takeaway message is that what we call homeopathy is something that has been around for a couple of centuries, and it has survived for a reason. And that reason is very simple. It works.